All right, well, we got a lot to talk about today, so let's jump into some cool topics. The first topic that we're going to do, to me, is like just really cool, really interesting. So have you guys ever heard of the face transplants that have happened from time to time?
I saw the
You know what we're going to talk about?
the eye transplant.
Okay, you saw it. Oh, very
Yeah.
cool. So today we're going to talk about the first combined eye and face transplant. And I have to tell you that, I mean, I do some pretty cool surgeries, and I consider myself a very, skilled and technical surgeon. But this stuff is just kind of like next level. I mean, face transplant, I mean, that's one thing. I mean, if somebody put a gun to my head, I could probably do a face transplant. I mean, it's just attaching muscles, nerves, blood vessels. I mean, I have the skill to do that.
Yeah.
Yeah, I know. I mean, that's like, it does take, I mean, I did tons of years of training after med school. I don't.
Light flicks.
Yeah.
Well, no, I mean, you wouldn't want me doing your face transplant, but could I do it? Yeah, I could. I mean, I do still sew blood vessels and nerves together, like in the hands. And so, there's not a whole lot of difference between a blood vessel in the face and one in the hand or a nerve. I mean, it's a lot more involved. Okay, anyway, fine. I'm not doing face transplant, but I'm just saying that potentially I could do one. But to add like the eye socket, because this guy apparently had his eye socket and the eyeball itself transplanted. So a little bit of back history. So the guy's name's Erin James, and in 2021 he was working around some super high voltage power lines, and it came into contact, and those lines will just like incinerate you.
Yeah.
It took off his left arm, and then most of his face, nose, lips, and his left eye. And so he had a pretty devastating injury. And in a minute, I got some pictures. So in the past, like when something like this happens, what we did is we just would close the wound as best we could. I mean, the thought of doing a face transplant was not really kind of in the sphere, 20 years ago, although it was shortly after that became a thing. And so I actually have a picture from a long time ago. It's a patient we did a case study on where they had a similar injury. Yeah, okay, so here. So this, I mean, I didn't want to bring the picture of like this cavernous like hole that this guy had, but this guy had this just massive face wound, and you have to cover it, so we used like a muscle with a skin paddle and then skin grafted the rest, and it's definitely not anything, to write home about from an aesthetic standpoint. Of course, this was 20 years ago, and it solved the problem of him having a cavernous hole in his skull, and well, not really skull, but like his face and bones. Yeah. And so it solved the solution, but like aesthetically, it's terrible. I mean, not anything that anyone would be happy with.
Yeah.
So then in the mid 2000s, actually 2005, the first face transplant was performed at the Cleveland Clinic. And I remember when that happened, I was like, oh wow, that's like serious surgery.
Big deal. Yeah.
And I actually brought a picture of that girl. She had gotten attacked by a dog. So on the left was her before her injury, and then the middle picture is her like right after her surgery. Not like the day after, but maybe a month or two after the surgery. And then the picture on the right is her years after. And yeah, I mean, she does look, different, but she looks very, normal. I mean, with little minor scarring around the lip, but for all intents and purposes, she, looks like a normal human being. And, that was like a really big thing when that first happened.
Yeah.
And overall, face transplants are still pretty rare. I looked it up, and it looks like in the last 20 years, there's been 19 done. Mm-hmm. And so the question pops up, it's like, okay, well, why isn't this, more common? Well, I mean, first off, you don't have a ton of patients who have such devastating facial injuries that they would need one.
Right.
There's just not a ton of patients out there. And then there is a lot of like selection criteria. Because when you transplant a face, it's like transplanting an organ. Like you have to match up things like blood type, the human leukocyte antigens.
Okay.
And so, like when people are on transplant waiting lists, it's the same thing for a face. I mean, you have to find a donor that matches up. Obviously, you'd have to match up the sex, right? Because, you wouldn't want to put a male face on a woman, right? So there's a lot of criteria that go along. So anyway, this guy, Erin James, had a pretty devastating facial injury, and he got hooked up with Dr. Eduardo Rodriguez, who I actually have a picture of him in a minute we'll show, and they attempted to do the first face with eye transplant. And the surgeon even said, there's a chance that this eye is just not going to take, that it's just, not gonna, it's just gonna wither away. But the thought process was, is if that happens, well, he still has the face part, right? You know, they can put a fake eye in. There's glass eyes. I mean, that's a common thing. But they wanted to try to get this eye to be functional. So they attached the muscles, they attached the nerve, even the optic nerve, which is, you know, unbelievable that they reattached.
Yeah, I was about to ask. I was like, it works, and it's
so
not.
Yeah,
like
we're
you
gonna
can
get to
see
that.
Okay, out of it.
It was a 21-hour surgery, and I'm sure it was a team. I think Dr. Rodriguez. I mean, I know he's the head of the team, but 21 hours, probably multiple surgeons, and so. Travis, let's throw up that first pic there. So this is that gentleman, Erin James, and so that was him on the left before his injury. The middle is like right before his transplant, after they kind of temporized his wound. So they've actually covered some of this with skin grafts, it looks like. But you see he's missing his eye, the nose is gone, lips, the face is just scar tissue.
That is serious.
Yeah, and then on the right is him. I guess just says 4 or 5 months after his transplant. I mean, there's a little bit of issue with the eyelid, but yeah, and they transplanted the eyelid too. I mean, that's utterly amazing. And then like there's another picture of him. Travis, pop on. Oh, that's the one from the front. Yeah, but I mean, he looks pretty normal there. I mean, I think that's a little bit further along in the healing process, and they're showing that the globe of the eyes looks, viable and actually looks pretty normal. Mm-hmm. So to get to your point, Sarah, about functionality, because that's a great question, right? It's like, okay, when you do these transplants, how functional are they? Well, that's where the limitation is, As far as the eye goes, he doesn't see out of it, And I'm not surprised by that. The rate limiting step to doing any type of transplant are the nerves. Blood vessels, you can tie them together, the blood flows fine. Muscles, you can attach them, the muscles will work fine.
Yeah.
Skin, nerves are a different story. Like when nerves get cut, it does a lot of damage. And even if you cut like your own nerve in, like say, and I do nerve repairs from time to time, you can get complete control back, but that's like your own nerve to your own nerve. I mean, it's a little bit different when it's a transplant cadaver.
That makes sense.
So, he doesn't see out of the eye, but at least the articles were saying that he does have sensation around the eyelid. So, some of the sensation is returning.
Yeah, I saw them they keep having to lift.
And that's because the muscles aren't functioning correctly.
Yeah.
So like his eyelid's drooping because to keep your eyes open, you have muscles that are pulling the eyelid up.
Right.
And so those muscles aren't functioning for him, and so there are some limitations to this. It's not like they transplanted this face and eye and he's like seeing out of the eye and his face is completely normal. But I mean, you have to start somewhere when you're doing these advanced technology surgeries. I mean, just to get it to survive and look normal, I mean, that's the first step.
Yeah.
And, as the technology for nerve regeneration improves, then maybe the next step is the muscles work better. And then eventually maybe you can actually transplant the eyeball to be functional.
Right.
And ultimately that's where we hope this would go. But I want to throw that guy's picture up there. I've never met this guy. I didn't actually heard his name before. Is Dr. Eduardo Rodriguez. He's chief of plastic surgery for NYU.
Nice.
But yeah, I mean, this guy has done, of the 19 face transplants, I think he's done like half of them. So
okay, so he's pretty.
This guy is like
seasoned.
he's probably the world leader in face transplants.
Okay.
So yeah, I mean, hats off to this guy, because like I said,
wonder how much that surgery cost, and if insurance helped that guy at all.
Yeah, for sure. I mean, that would be considered reconstruction, and so it would fall under, insurance. I mean, when they do these things at like university centers, I mean, it's a little bit different than if I need to have my appendix out.
Yeah.
And I'm begging my insurance for that or whatever. That's a good question. I mean, that's a great question as to how much a surgery like this would cost. I mean, OR time is expensive. I mean, you're talking, $1,000 an hour for that, plus all the equipment, all the fees for all the staff. I mean,
and you said it was 21
hours. Yeah. I mean, a surgery like that would probably, like real cost would probably be $100,000. Now, what insurance would get billed? I mean, who knows? I mean, what things cost and what insurance get billed, and then what insurance pays, like numbers that are all just all over the map.
Right.
There's a friend of mine who was keeping a close eye on that story,
Oh, yeah.
no pun intended, but because they are missing their eye.
Are they?
Yeah, there was a accident that they had when they were a child.
Wow.
And I think somebody was swinging like a stick for a piñata and it hit them in the eye. And their eye like is missing now. So
Really?
they were very like glued into that.
Yeah.
Just because they wanted to see if the eye was actually like functioning.
Well, I mean, you know, the cool thing about it is at this point you could probably say that instead of a glass eye, which does have problems, you could transplant a living eye, and it seems now that it would take, you know, the question is the function.
Right.
You know, and I think honestly, before you can transplant an eye and it's functional, I mean, you're probably looking at decades at best. I mean, because I mean, in the 20 years that I've been doing surgery and doing things like nerve repair, I mean, there's been a little bit of advancements, but not like tons, you know, and nerves are always the kind of catch when you're repairing things.
I wonder, because like nerves, like what if like it like down the line he just like wakes up one day and he can see out of it?
That would be amazing, and I hope that happens, but you know, the problem with nerves is, you know, when you imagine a nerve, think of like a really big cable that might be running through this building, and you cut that cable open and there's 100,000 different wires, okay?
Yeah.
Now, if you cut that cable, if it's big enough, yes, you could resplice each of those individual wires, but nerves are tiny. So when we repair nerves, we typically, I mean, especially the small nerves that I repair, you repair you try to line it up as best you can, but it's not like you're reattaching the individual nerve fibers. It's just not technically possible. So you're putting it back together, and then the nerve tries to grow through. It tries to send the signal from the side that's closer to the brain into the side where it got cut, and push through to re-innervate. And it does happen. I mean, when I do nerve repairs like in the wrist and the hand, I mean, most people get a good amount of function back. I mean, it's not always 100%.
Like the surgery I had on my elbow when I was a kid, I had nerve damage right here. I couldn't feel like anything on my forearm for like a while, and then randomly it came back.
Yeah, and sensory nerves and motor nerves are different. Like usually
weird.
sensory nerves are easy. So sensory, obviously the ones that let you feel, motor, the ones that let you move. You know, sensory nerves are a little bit easier to come back you know, than the motor.
Interesting.
Yeah. So, but yeah, I thought that story was fascinating. I mean, yeah, being a plastic surgeon, you know, hearing about face transplants to me is super cool. I personally don't have any interest in doing them. But then when they transplanted an eye and eye socket, I was like, holy, that's like legit.
Have you ever seen Get Smart?
Yes.
And
like the new one with what's his face?
Yeah. Well,
Michael Scott.
Yeah, Michael Scott was in it, but the girl, what's her name?
Oh, Anne Hathaway.
Anne Hathaway.
I love her.
She's in it, and her character, she has a face transplant because she's a spy.
Oh, right. Yeah, I remember that.
And it was like a joke because he asked, like, what did she look like before? And he was expecting her to look like plain. But it was like another supermodel looking person.
Right.
He was like, oh, yeah.
Yeah.
Good thing you got your face transplanted.
Hey, who knows in the future, like 100 years from now, maybe, you know, people will pay cosmetically to get a better face. You ever think about that?
Maybe
could be happen. I mean, that could be a reality. I mean, that's like some serious ethical issues, but
yeah, but then it's like, why wouldn't you just get plastic surgery to like make it better?
I don't know. Maybe you just want something.
I guess if you really wanted to look exactly like somebody else.
All right. Well, cool story. Hey, let me know what you think about the eye and face transplant. We'd love to hear your thoughts, and don't forget to hit that like, subscribe button. It does help us so much.